Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
What are the glucocorticoid therapy in rheumatoid arthritis? So, in the rheumatoid arthritis, glucocorticoids can be given. What are the indications of glucocorticoid therapy in rheumatoid arthritis? In rheumatoid arthritis, glucocorticoid therapy is given in conditions like pleural effusion, pericarditis, or eye involvement. It can be used in mononeuritis multiplex cases. We can use this glucocorticoid therapy. If the NSAIDs are not able to, if the NSAIDs do not control the symptoms immediately, so in order to control the symptoms or for anti-inflammatory effect, we can use glucocorticoids along with NSAIDs. It is also used as a bridge therapy when DMARDs are started, we should use this glucocorticoids as a bridge therapy. And one more important thing is these steroids do not prevent the progression of the disease. The progression of the disease is only and only prevented by the DMARDs, that is disease modifying anti-rheumatoid drugs.
thank you and thank you for watching.